Okay, so we are going to do wound dressing, change, and measure and tape, irrigate, and everything. The first thing we need to do is medicate the patient 30 minutes before we start the procedure. And that during that time we can check the chart and see how many gauzes they've put in there, if or whatever has been done to the patient, the measurements of the wound, or anything that has been done to the patient before. We can check on the chart and wait for the medication to kick in and gather the supplies, which includes the sterile kit and normal saline and an extra set of sterile gloves and for measuring, for culturing, for Montgomery straps and everything and irrigation. We need a basin. I don't have a basin here, but we need it for irrigation and for draping also. We need that for the patient, for like a barrier and whatnot. So we have this for draping the patient. So after the supplies, we're gonna go and tell the patient what we're gonna do, explain all the procedure, and also position the patient ideally on his side or her side because that's going to help with irrigation and access to the wound, depending on where the wound is. Well, in this case, we are going to use the one that is on the back of Seymour butt. And once the patient is positioned, we are going to drape the patient, making sure that we only expose the area that we're going to work. Also, some kind of barrier for the linens, some water resistant barrier. And we're going to put our protection equipment, like, well, our PPE, which is, well, the gloves, the mask, or the gown, the mask, the gloves, and everything that we need because this might splash and whatnot. So, and we also need something for garbage, a biohazard. So if we have garbage can and also a biohazard disposal that works, and we're getting ready. So we're gonna wash our hands and put gloves. Let them they are dry. Put gloves on, which my gloves are right here. In the meantime, I make sure that the medication has had enough time because it might be painful. So pain medication, obviously, that's what I'm talking about. And the position of the patient is adequate, and I'm going to um, remove. Okay, that's what I need. I'm going to remove whatever the patient has. So if there's any tape and any gauze or ABD, which is what we're going to do. So if it's been the same, then I'm going to remove it. This is going to be towards the patient or towards the center of the wound. If there's any crusted gauze or anything, I can soak it up with a little bit of sterile water or tap water just to soften it and, well, to make it easier to remove. Um, so after I remove that, I'm going to assess the wound. And part of the assessment, of course, not only the size, but the odor, the color, yeah, the size, the shape, and any characteristics that tells me something, if it's red or not, if it's infected, if it's healing, if it's getting any better or not. Any changes that I see from what I read on the notes. So after my assessment, well, of course, I disposed of everything in the biohazard, everything that I got out of the wound. So after that, I'm gonna measure the wound without touching it. I'm gonna place this on the center of the wound, and the measurement is it goes head to toe, hip to hip. So this circle helps, but I can use this in centimeters also. that is a measurement, and hopefully having somebody with me so they can record these measurements and write them down. So that is the measurement part of it after assessing. Something important also is that if there's any tunneling or anything that I have to specify, then it's going to be using the 12 o'clock measurement. Like I'm going to describe, there's tunneling at 2 o'clock or at 7 o'clock, there's necrotic tissue or whatever helps me describe 12 o'clock. I mean, the clock face. So after measuring, I'm gonna get ready to irrigate. So I would have a basin, and my patient is, of course, tilted towards me. So I have access, but also the water runs off, and so I'm gonna have still dressing. I mean, normal saline, still water, and a Toomey syringe would be also helpful because I can get the water and I can, with the pressure, I can irrigate it and starting from the top, going down because gravity is going to help get all the stuff down. And until it runs clear, the water, that would be the ideal moment. So the sterile saline. Now, after it's clean, and this is, I think it's the right moment to culture it. So, for the measurements, if there's any tunneling, also a sterile swab would be helpful because the way I would do it, I would put it in, mark it, and measure it. So and have somebody else also measure that. So we're gonna pretend this is also for culturing. It's a tube. It's a long tube that I would break off and get the swabs, and I'm only gonna culture the granulating tissue, not the slough or any of the not necrotic tissue, not slough, not blood, any of that. Um, so just that, and when I put it back in there, of course not talking because so I make sure that I don't touch the edges of the tube, and I insert it. If I need to crush anything down here, then I crush it. Once it's closed, I'm going to label it with the time, place, patient, who collected it, what it is, and send it off to the lab in a biohazard bag. So that would be done. Um, so I measure, and um, well, if I when I after irrigating, if there's any water or anything, I'm just going to pat it dry. This is going to be 2 centimeters away from the patient, the Toomey syringe. I didn't mention that, so now I'm mentioning it. And, well, it's cultured and labeled and everything. So now I'm getting ready for, oh, of course, I'm going to change my gloves, wash my hands, or dispose of the dirty gloves, wash my hands, and put the other ones on. I can do this repeatedly for each one of these steps. And then I'm moving on to the sterile field. So this is my sterile kit. So what I would do is place it in the right way. The first thing is to place it away. Well, and this is backwards, but anyway, it's away, away. And actually, I'm going to take these off. Towards, towards. And then here I place it properly. I can touch only 1/4 of the edges of this. The first thing I get out of here is my sterile gloves, which they don't look sterile gloves, so these look more like sterile gloves. I'm gonna put only one on. Alright, so I have one sterile glove on because I'm going to get rid of this one, or I could use it if I want to use it to protect here, and I have the basin. I can dispose of that in the biohazard, or I can dispose of this one too. This one I also want to, well, we'll put it over here. I want my swab. I want dry gauzes or 4x4s, especially. I don't know how many of these I'm gonna use, but well, let's say that I read that there was, I don't know, 5 of them. So I don't want to use them all. I want some dry and some wet. And this I won't use, so I can dispose of it. This one out of the way. And again, I have lots of swabs. I need my tweezers and maybe my scissors too. So this is part of my sterile field. Right now I'm below my waist level, but I'm not supposed to be because the level. Actually, this would be better. So, okay, now I can put my other glove on. And this was backwards, but okay. Now I made a mistake because I'm not ready for this one. So I'm gonna take it off, and this is why I have a second pair. So I dispose of it, and this one's done because. But I have a second pair. I didn't touch the water, so I'm gonna have to do it again. Well, I only need one. Ideally, it's my dominant hand, which is this one. But in this case, this one's my non-dominant. This is the one that's going to be sterile for now. I'm going to grab the water, loosen up the cap and take it off. And about 6 inches away, pour some normal saline in that container and return it. So I have my water. That's basically all I need. Of course, when I touched that bottle, and I made a mistake again. So another pair of gloves. So I would have somebody else bring me a pair of gloves because I touched this one, so I can't use it anymore. So I would take it off and do it again because the right way is with this one. And hitchhiker, and now I'm sterile. Okay, now I'm getting ready to, that is clean. So with this, the gauze, I would use my tweezers, get some gauze wet, and alright, now it's wet, but I would do one by one and remove the excess water and place it in the wound, not touching, and of course that went off. So just placing it in the wound, it's not going to stay, obviously. Not touching the outer side of the wound, the skin, just inside the wound. If there's any tunneling, what I use is this to kind of pack it, not too tight, but just pack it in there. And I would do the same with the rest. Of course, if this hasn't touched anything, then I can reuse it. So if I just dump it there in the wound, if the wound is, I don't know, that big, then I can do that. If this touches anything, then I can't use them. Or I shouldn't touch the wound because it can be painful. So All right, and then pack it. Let's say we need only one more. So there was 5 before, now there's only 3. That is a change, and that is something that I want to record. And these are wet. Again, I take the excess water here. So that is the right thing. Excess water, put it in there. Once I'm done with that, then I'm ready to put the 4x4s, 2 4x4s, dry on top of the wound. And then my ABD pad, it depends on the size of the wound. It can be folded or ideally not. I mean the right size. So this one here. And then at this point, I'm not sterile anymore. And then I can use the Montgomery straps, which I previously made some. And the way you make Montgomery straps is you take some tape, pull it over, then again, then make a little slit on it, like a little hole. Actually, I'm going to do it because this one wasn't right. So, well, just for time's sake, I do have one here that is right. So the hole is in there. And then this one goes, I don't know, 2 centimeters away from the one. And these are, so I don't have to be removing the tape too many times. And then I can use something like this to hold the ABD pad. Go through it, and then through another one on the other side. So this one would be on this side, the other one on the other side. And the knot would be on the side, not on the dressing, because the patient's going to lay on it, and you don't want any pressure point, any extra pressure point. So that's why it's on the side. If the skin of the patient is very sensitive, might not tolerate those, and then I would have to find the right tape. There's some stretching tape. There's different types of tapes, depending on what the patient can tolerate, how the skin condition is, and well, then I can tape the sides of the wound dressing if the skin is fine. Like I said, there's a few different types of tape, but the Montgomery straps is the idea is not to take them off too many times. So that is basically it. It's changed. Then I would check with the patient, check if he's okay or she is okay, and then reposition the patient the right way, and just record whatever I have, measurements, amount of gauzes, and how the patient tolerated, time and everything else. And that's it.